It's normal to have upsetting memories, feel on edge, or have trouble sleeping after a traumatic event. But about 15 million people in the U.S. will suffer from PTSD. That's according to the National Center for Post-Traumatic Stress Disorder. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about who's impacted by PTSD, the trauma that can cause it, and therapies that can help people suffering with PTSD. With me today is Monty Miller, psychotherapist at St. Luke's Health System. Thank you so much for joining us, Monty.
Thank you, Lindsay. I'm glad to be here.
Well, first of all, what is PTSD and what are the different types?
Well, PTSD is a mental health disorder that can occur with anyone who's experienced a traumatic event or witnessed a traumatic event. The different types of PTSD, we have delayed onset, and that's for those who maybe experienced a traumatic event, but maybe 6 months later they didn't start experiencing symptoms until then. We also have complex PTSD, and that's mainly with childhood PTSD it's very complex, and it's childhood abuse that went on earlier in their lives and is still affecting them later on in their life. We also have birth trauma, which is where maybe a mother who was delivering a baby had a traumatic event, and therefore now they have difficulty with PTSD, and they have difficulty walking by the nurseries, walking by the doctor's offices, maybe meeting with women who are expecting. It just brings up those issues and those PTSD symptoms.
So who can be impacted by PTSD?
Well, anybody can be impacted by PTSD. Anybody who experiences a traumatic event or actually sees or visualizes a traumatic event in somebody else. We often think it's related to military because the military combat, and years ago they used to call PTSD shell shock. And so we do think about it military. However, it's not just military. It's first responders. It's those who were on the front line of COVID, seeing death every day, created PTSD. Of course, our nurses and our medical team here have very much experienced that. And we're working with those in our outpatient practice. We've also those who school shootings or any of those shootings that we see out in the churches and in our parking lots and in the schools creates trauma for the students, the teachers, as well as the parents.
Okay, so it can happen to anyone.
Yes.
So you mentioned that PTSD happens when someone experiences trauma. What are the different types of trauma?
Well, you can have the type of trauma is primary trauma and secondary trauma. With primary trauma, it's those who actually experience the event of the trauma. And then secondary trauma with those who hear the stories of those events. Like myself as a psychotherapist, I hear a lot of traumatic stories, and it can impact me as well and create PTSD.
Okay. So what's the most important thing that people should know about treating PTSD?
Well, it's very treatable, that you don't have to live and suffer with PTSD, that there are great therapies out there today that can help people heal from PTSD.
Okay, good. Well, what types of therapy are there for people who are suffering from PTSD?
Well, we have our traditional kind of EMDR therapy has been out there for a long time, and that's eye movement desensitization therapy. And that uses eye movements with bilateral stimulation that helps heal those traumatic events. Now, that therapy can take anywhere from 6 to 8 weeks. Okay. There's also a newer therapy out there, which is called ART therapy, Accelerated Resolution Therapy. And myself and 2 other colleagues are certified in this therapy to practice that in our practice here at St. Luke's. And in fact, we're one of the only hospital-based programs that offer this service today. And there's only a few really in Kansas and Missouri that are certified to practice this therapy. But in this therapy, I use eye movements as well. However, it's very scripted, and you can help somebody within one session, within 2 sessions. There's also somatic therapy, and that's when in somatic therapy, we listen mainly to the things that are going on in your body. So you hold the trauma and the anxiety in your body, we locate that, and we try to minimize and relax that part in your body. There's also CBT, and there's cognitive processing therapy. There's all kinds of therapies. But I'd say ART and EMDR has been real effective in the last few years.
Okay, very interesting. So what are the symptoms that you should look for either in yourself, a loved one, or if you're a guardian looking in your child?
That's a great question, Lindsay. I think typically you'll have those with PTSD will have flashbacks, will have memories of the event, or they'll be totally closed-minded and emotionally shut down to where they don't want to think about it. They don't want to talk about the event. They won't go near the places that kind of trigger those feelings. may have anxiety, depression, OCD can also come out of that PTSD or that trauma event. With children, you might see some anger issues, irritability. You might see problems in school. You might see them regress to earlier ages, or bedwetting, and those kind of things that you could look for in children.
Okay. So what's your final message for people who are watching today?
Well, the final message is really, if you think about it, trauma creates change that you don't choose. However, healing is about creating the change that you do choose. And we can do that.
Okay. Well, thank you so much again for joining us.
You're so welcome.
To find out more about St. Luke's behavioral health, including free webinars on dealing with stress, anxiety, and more, visit stlukeskc.org/behavioral. You can also stay up to date with all the latest on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.